HealthRadioMD.
RadioMD.com.
It's health delivered daily. Melanie Cole's Health Radio.
Holistic dentistry is also called biologic dentistry, alternative dentistry, unconventional. There's so many different names for it, but what does that mean as treating a person as a whole person rather than just their teeth? My guest today is Dr. Vladimir Gashinsky. He's been in private practice in Millburn, New Jersey. He is a dentist. Welcome to the show, Dr. Gashinsky. What is holistic and biologic dentistry?
Holistic and biologic dentistry basically is the same. We are talking about what you said exactly. This is how they treat the whole body, whole person, because the teeth are part of the body. And if something's going wrong with the teeth, it affects the whole health. It's for biologic dentists or holistic dentists, it's very important what you put in the patient's mouth. You know, that material, restorations, anything they put in the patient's mouth may affect patient health. And that's why we're very, very cautious on material we put in patient teeth. Make sure it's not going to affect their health.
So we're considering dental health in the context of the patient's entire physical and emotional and spiritual, maybe in some cases. Now we're learning more and more, Dr. Gashinsky, about that gum problems and such can contribute to plaques in the arteries, and that heart disease, can be a link to dental issues and plaques on the teeth and such. So tell us how that connects. How do what you see in our mouths kind of affect our whole bodies?
Definitely, they say connected. And it's not only the cardiac conditions, it's also diabetes and also certain cancers. Statistically, from the medical field, we know if patients have a gum disease, their chance to get pancreatic cancer increases drastically. Kidney cancer, pancreatic cancer, and that's why in my practice it's very important to treat patients with the gum disease and just stop the process and make patients healthier.
Okay, so then let's talk about some of the things. I mean, people have to have root canals. Sometimes they're in big, huge pain, but you don't necessarily agree with that. And also, I'd like to ask you about water fluoridation. So start with the root canals. Why is this an issue?
Root canals is an issue because it never can be 100% sterile and cleaned up. Because if you look at the tooth, it looks like not big one, but if all the small channels that inside of the tooth almost 3 miles long. For the molar tooth with 3 roots, almost 3 miles long. You cannot clean 3 miles. You know that if patient really insists to doing root canal, we have to do something extra for them, using laser, using ozone, really just looking at the immune system, if its immune system can handle this. It's a very, very important issue.
Okay, so if it can never be totally sterile, what is a person to do if they do need a root canal, if they're in such pain that they need that root fixed, taken out, desensitized, whatever it is you guys do, what do you do in place of it?
In place of it, we provide patients with the implant. And in my practice, we provide patients with non-metallic implant. They call zirconia implant. Basically, this is ceramic, very strong one, white color, and this is believed in dentistry, holistic dentistry is most biocompatible material as we have today.
Wow, that's very interesting. And what about fluoridation? Why is that something that is maybe viewed unfavorably?
That it's a very controversial issue, and that a lot of talking about some areas have fluoridated water, some is not. But as a holistic dentist, I choose not to use fluoride in my practice.
And why is that? I mean, with kids, they say that, with kids that they need that fluoride treatment every once in a while or to keep their teeth strong. Do you not use it with kids either, and why?
I don't use it with anyone because, that I believe that we have a better modality. We better talk to mom and make the dietary changes and just make people healthier. In reality, in the healthy mouth, there is not supposed to be any decay. Healthy body protects itself.
Well, that is a very true statement, and a healthy body does protect itself. What dietary changes do you recommend? I mean, obviously, you dentists all hate the sweet stuff and soda and dyes and colors and sugars and additives and such. What do you tell parents and patients of yours about dietary changes they can make?
I really want just to be a minimum amount of sugar, minimum amount of sweets. Only the sweets is coming from the fruit. And I don't want the kids to have too much processed food. Basically, I against the processed food. Unfortunately, it's take a lot of on mom because she has to cook, and it makes sense, if food prepared properly, and this is basically most of the time it's fresh, it just affects the patient's health. And we know that body acidity change. The better diet, the healthier body acidity, and just allow body to heal. The same with the kids. You feed kids properly, you give them the proper diet, no sugar, the minimum amount of starch, and they do great.
Well, I mean, that's all really sound common sense dietary advice, really, keep that healthy body. And like for our teeth, sometimes kids, like my daughter, Dr. Gashinsky, she eats very healthy. We eat very healthy in our house. I'm an exercise physiologist and I love to cook, and she still gets cavities.
We really have to take a look on this because we have something different instead of fluoride. And we're using it in the office. So we just basically pushing the calcium inside of the tooth. You know that from outside of the tooth, we're just pushing the calcium in. We do use a special paste, but we apply on patient teeth instead of fluoride.
So what do you do for a cavity?
Cavity, unfortunately, needs to be fixed.
So is there like a specific filling that you'd prefer? You don't use typical fillings or what?
Specific filling we prefer. This is first of all we have to check out the quality of the restoration. We never use material that has, that we're using material that basically most of biocompatible. This is we're going to talk about a different topic. Over the years of practice, we try to figure out what material is the best for the patients. And for patients who come in our practice, we send them for specific tests. It's a blood test, and it's called Clifford test. Over many, many years of using the Clifford test, we find out which material is best for the most of the patients and which one is not. And basically, this material is not the best, we eliminate it.
So what do you tell patients if someone wants to look for a biologic or holistic dentist for themselves? How do they find them? Is there some different regulation on you all? Is there some different training or education?
There is no regulation. This is a different training, this is for sure. You might be trained with International Academy of Biological Medicine and Dentistry. You might be trained with International Academy of Oral Medicine Toxicology, Holistic Dental Association. This is three major associations that are giving the courses for the dentist for holistic one. And what you have to look what they really provide you. If the dentist provides a safe amalgam removal filling, if he follow all the protocol, is the dentist can just really give you what you need in terms of the biocompatibility testing, in terms of that keep you healthy in the office. That if a dentist might be latex free, which is that some people come in, are you latex free? Yes, we have latex free gloves. And how the patient, if needed, treated for root canal, do we have a laser in the office?
Yeah.
Do you provide a non-surgical gum treatment?
And it's so interesting. It's so interesting, Dr. Gashinsky, and so much common sense. So if people want to see more about you, they can go to holisticdentalcarenj.com. This is Melanie Cole. If you missed anything, you can listen anytime on demand or on the go, radiomd.com. Stay well.